Welcome to Daily Dose. We're going to be continuing on in chapter 13, and today we're going to talk about the surgical package. Often, the time, effort, and services rendered when accomplishing a procedure are bundled together to form what is called a surgical package. Payment is made for a package of services and not for each individual service provided within the package. The CPT manual describes the surgical package as including the operation itself, local anesthesia, and typical postoperative follow-up care. One related E&M counter prior to the procedure, and then immediate follow-up, which is just called the follow-up care, including written orders. So included into the surgical package this is just some things, it's not all of them, but preoperative visits, intraoperative services, complications following the surgery, postoperative visits, supplies, miscellaneous service such as dress changing, catheter removal, etc. Okay, let's talk about the time period following the surgery that is included in the surgical package. It is established by the third-party payer and is referred to as the global surgery period. The global period is usually 90 days for major surgeries and 10 days for minor surgeries. Okay, so let's talk about this just a little bit. Let's say cardiologist is doing a pacemaker. So before he makes it to his 90 days, that's the global for a pacemaker, there's an infection around the pacemaker. So if that patient has to have anything done because of that, it is already built into the surgical package. Global periods are not going to be confusing for you once you start your career, because they're going to tell you what the global package is or global period is for each one of your procedure codes. All right, so let's do just a couple of questions just to kind of refresh our memory. These are found at the beginning of each section and contain information specific to the section. They're in green, and they're called your guidelines. I am encouraging you to get into your guidelines, make notes, highlight in your CPT, and get to know each section. All right, the last question we're going to ask today in our daily dose is, what is the largest section of the 6 CPT manual sections? What's the largest? It is the surgery section. I hope you have a great day and see you for our next daily dose.